Okay, so we'll probably get started. We've got a good little group coming. Again, if at any point there's any technical difficulties, if you guys lose sight of my presentation or anything, let me know, but I'll try to keep us on track. So I want to thank you guys all for coming and for taking time out of your day to come listen to us chat. I'm super excited about this. We've been preparing for it for a while. But I want to introduce everyone. So first we've got Dr. Behnam Banihashemi. So he's a double board certified cardiologist with 10 plus years of clinical experience. He's advanced training in echocardiography and nuclear cardiology. He's a University of Ottawa MD and got specialty training at University of Toronto and Ottawa Heart Institute. And he started the Cardiac Longevity Clinic with a focus on preventative medicine, healthy aging, women's health, and personalized care. So at the clinic itself, they do a lot of advanced health assessments for heart health, metabolism, and overall wellness. They focus on early risk detection with personalized strategies for prevention, energy, and longevity. Evidence-based care for perimenopause and menopause, and very focused on symptom relief, prevention, and long-term heart health. We also filmed a podcast together. So if you guys are in the freeform fitness community, I suggest giving that a watch. It's great. It was a fun conversation. Next, we've got Christine Harrison. So she's a registered psychotherapist, registered clinical therapist, and has an MBA in public health. She is the founder of Focus Forward Health, which now has locations in Ottawa, Pembroke, and Stittsville. She's an entrepreneur, a professional athlete, and an advocate for whole person wellness. And is focused on integrated mental health and wellness organization, offering evidence-based care. And her services include psychotherapy, lifestyle medicine, and innovative treatment approaches. She also did a podcast if you're in the freeform fitness world. So check that out. I wasn't on that one, but heard it was a great conversation. And I'm really excited to talk to Ben and Christine because they are both very active people and practice what they preach, and it's going to be a fun conversation. And then as for myself, so I am a NASM certified personal trainer, which is NCCA accredited. Most of my continuing education has been done through the Postural Restoration Institute, which focuses on nervous system balance, specific breathing techniques, and I really got fascinated with the science of asymmetry and how your breathing patterns and your breathing mechanics affect your movement strategies. So that has moved my personal training work to be more integrative and holistic. And I think that all of our perspectives are pretty holistic, and I'm really excited to have a meeting of the minds. As for freeform fitness itself, we are a personal training gym, if you're not familiar. We do personalized 30-minute sessions, so personal training only, and we do supportive coaching for all fitness levels, so you don't have to be experienced to get started. We coach beginners all the time, and we do integrative strength, mobility, and health-focused programming tailored to your goals. So we're going to start with chatting a little bit. I'm actually going to hand it off to Ben for a few words. And I'll let him introduce himself a little bit as well, and we'll get started, okay?
Thank you, Chiara.
Yeah.
So, hi, everyone. Thanks for joining us. I'm very excited about this conversation. As Chiara mentioned, I think we are kind of a group of co-hosts where all of our philosophy about health, and particularly women's health, very much closely align. And we thought this would be a great opportunity to have a good roundtable conversation, hopefully provide you with some education and some awareness about some of the things that you need to be aware of as women in every stage of your life. And the reason I think this is important is because I think education is a huge part of the empowerment to really help you make the right proactive choices for your health at every stage. And there's a lot of misinformation out there with social media. And I think one of the things we're going to try and accomplish is really to bust some of those myths that you see, be able to differentiate between real data, real evidence, real science, and some of the false information you see out there. And I think one of those myths that you see a lot is that when people talk about women's health, they usually think about reproductive care only, whereas women's health is way above and beyond that. It includes hormonal health, cardiovascular health, metabolic health, brain and emotional health, as well as bone and muscle health, and overall a customized lifestyle strategy based on whatever stage of life you're in. And as you all know, and some of you have experienced, your body goes through quite a bit of changes from puberty to reproductive years, and then ultimately through perimenopause and menopause. And your hormones at every stage, hormone levels are quite different, and they influence every system in your body. And really the idea is women require much more than men. They require this kind of a biology-specific lifestyle or lifespan-based care at every stage. So you need to be much more intentional and much more customized with regards to how you take care of yourself and your body at every stage of your life as a woman, depending on kind of your overall hormonal metabolism and assessment. So the main reason for that is because hormones essentially change across the lifespan. Obviously, you're all familiar with estrogen and progesterone. They have a massive influence on every single system in your body. Estrogen in particular, it affects your vascular tone. So for me as a cardiologist, estrogen in women and their level of estrogen is quite relevant to their cardiovascular risk because it controls the cholesterol metabolism, it controls the glucose regulation, it controls collagen and bone turnover, the neurotransmitters, as well as sleep and thermoregulation. And these hormonal shifts, I mean, you're all aware of it. It happens through the menstrual cycle, but also in the bigger span of your life, it really changes during pregnancy and postpartum. So we deal with a lot of different health concerns and intentional health strategies around pregnancy and postpartum, but also during perimenopause and menopause. And really, I think it's very important to think about these symptoms not as an inconvenience, but as a signal that you need to be intentional about a healthcare plan.
It's information.
Thank you. Yeah. So I think basically what happens is as these hormones change, there's a whole bunch of changes that happens in your body. So one of the main things that I think every woman experiences in different stages of their life is, for example, body composition change. We're going to talk about it more and some of the lifestyle strategies you can use to kind of evaluate your body composition as well as optimize your body composition. But definitely increased visceral fat, which then leads to insulin resistance, lipid metabolism changes, sleep disruptions, mood vulnerabilities that we're going to talk about. These are things that definitely fluctuate a lot with your hormonal levels. And a lot of these shifts in your body actually happens even before you develop symptoms. So really early awareness and education and attending webinars like this is very important because you need to be aware what you should anticipate as you go through different stages, because if you understand your body and understand those hormonal changes, then you can really take proactive measures in order to really optimize how you feel, but also reduce your risk. Next slide.
Sorry, it's glitching.
Oh, no.
Get it out of the way early.
There we go.
There you go.
So, I mean, for me, as I said, as a cardiologist, I'm very interested in women's health. And the reason is because hormonal changes in women are very much linked to their cardiovascular risk. So I assess a lot of women, younger women in their pregnancy and postpartum phase, because there's a whole host of cardiovascular complications that can happen at that stage. So I see a lot of women in that stage to evaluate them for cardiovascular disease, treat them for possible cardiovascular complications of their pregnancy and postpartum. I'm sure you've all heard of polycystic ovarian syndrome. Again, that could be an entire talk by itself, but that is a factor that is a condition that many women experience, and it can significantly increase their cardiovascular risk by increasing their metabolic chance of metabolic dysfunction and raising their blood pressure. And of course, perimenopause and menopause, as you know, is a big checkpoint for women with regards to the importance of cardiovascular assessment, because your risk goes up at that time. And that is because of, again, some of the changes that I've talked about. Your lipids change, your blood pressure goes up, you develop insulin resistance. Usually women gain weight and they gain visceral fat, and their muscle mass starts to dramatically drop in kind of that postmenopause space. So again, kind of an emphasis that prevention is extremely important. And that's one of the things we do in Cardiac Longevity Clinic, is really coming up with a lifelong kind of longevity strategy for every decade of women's life to try and essentially optimize them from the cardiometabolic standpoint, body composition standpoint. We assess kind of bone density, sleep quality, and kind of put that together with their family history to kind of give them a very personalized plan depending on the hormonal stage and the life stage they're on. And yeah, if you want to find out more about us, you can definitely kind of look at cardiaclongevityclinic.com to kind of read about some of the services that we provide, particularly for women.
I'm going to hand it off to Christine to give a few words as well. She's psychotherapist, so she's going to talk a lot about mental health and burnout.
Thanks. And I wanted to just, Victoria has been popping things in about chat. So Victoria is the marketing manager from Freeform Fitness, and she's going to be able to rally all these questions up and help us out. So thanks to Victoria's help here. So hi, everybody. Welcome, ladies and sons of ladies, if there are any gentlemen other than Dr. Ben here in the chat. It's really great to have everybody here. And my piece is always going to be on mental health and that intersection between, you know, it overlaps nicely. This is why we're such a great trio, because we overlap with kind of that physical, the active, although I don't know much about the heart and I won't speak. Dr. Ben doesn't want me talking about women's heart, but I can talk about the emotional heart. And I can talk about the weight that we carry in our heart and the stress. So one of the big things that presents with women in all ages is this high functioning anxiety. This is the key that we're seeing in our clinics a lot. And high functioning anxiety, there's some signs: overthinking, perfectionism, people pleasing, and difficulty switching off. Now, those are some nice topics, but I like to kind of explain what they mean. So a big part of difficulty switching off is that women carry a lot of invisible load, right? So I always like to bring up personal things or things that we've heard in clinics. It helps kind of make the points land. The invisible load, and I can remember kind of in my late 20s and 30s, was always dinner. What am I making for dinner? And I remember the 3 o'clock dread would hit. This is invisible load. Nobody knows that I'm treating patients, but I'm thinking about peeling potatoes and stopping at the grocery store. And the key is that nobody even liked what I made for dinner, but this invisible load would weigh on me all the time. I would have the same anxiety set in every day. Caregiving, whether that's parents or children, taking care of a home, maybe you're the house manager, which is a term I like to describe to women that we see in clinic, because they often don't think of themselves like the house manager, but historically we see a lot of those roles. There's the emotional labor of worrying about everybody else. So that's part of people pleasing, is thinking about how everybody else is being affected. All of these things are all part of this invisible load. And then of course, relationships, navigating relationships, coworkers, career-based, neighbors, family relationships. And the really interesting thing is that women have really become these experts at functioning really well while struggling. And many of you, if any of your cameras were on right now, in my head, you're all nodding your head yes. You're like, dang, yes, I get this. So that difficulty turning off, the people pleasing, this perfectionism, this overthinking, it starts to weigh pretty heavy on women. And you can go to the next slide if you don't mind. And we can talk a bit about when it weighs heavy, what are those signs and symptoms? Well, the chronic stress impacts are our sleep's going to be disrupted. Again, if your camera's on, I know that you would be nodding right now. And I suspect if I said, put your hands up or have a reaction, who's waking up at 3 a.m.? And when you think wake up at 3 a.m. or maybe 4 a.m., I suspect that your brain turns on and you start thinking. That is a disruptive maladaptive habit. We can help you with that. We can give you the skills, but some of it could be hormone related. Your cortisol could be spiking. You could lack progesterone. You could have too much progesterone. You could have not enough estrogen. We often see that digestion gets affected. So when we are increasing cortisol because of stress, because it naturally peaks in the morning, but if you're overly stressed, you're consuming a lot of coffee, you're going to notice that your entire imbalance is racking up, which is going to create a little bit of a hormone that makes you hungry. So you're going to find that your stomach feels hungry a lot. And typically our body will go and say, like, let's find carbs because we're potentially starving, right? Our brains are the same brains we've had as cavemen. So it only knows caveman techniques. We have more sophisticated problems, but we still function the same. So now we've got too many carbohydrates. We're stressed. We're sweating. We're taking our jackets on and off. So now we've got immunity issues. All of a sudden now you're susceptible to more illness, right? White blood cell count could be super low. Who knows what's going on? Bacteria. One of the big things that we hear a lot is concentration. Well, not just the lack of sleep that's being disrupted, but also hormone imbalance. So, there's brain fog. Oh, what was I doing now? Or I can't remember, or you're making multiple lists and leaving them around. That isn't part of healthy aging. That's part of mental health concerns. So we see on the left-hand side of the screen, we see that the term emotional burnout comes up a lot. An emotional burnout is something that I would really describe as kind of a longer period of distress that doesn't have a resolution. And we'll talk a little bit more about that. Decision fatigue. So decision fatigue for me was, what am I going to make for dinner? Right? The 3 o'clock dread. What am I going to wear is another thing from women. So they're wearing the same thing. They just can't make another decision and figure out what they want to wear, what they want to do. What do they want to do on the weekend? Caregiver burnout. So either caring for children or parents or neighbors, friends, shows up, and we start to get impatient with people, right? We start to change those dynamics of those relationships, which is never our intention when we're there to help. And then, of course, the invisible labor overload, which could be around caring for the home. The house manager is also the janitor, the plumber, the maintenance person, and the organizer. Next slide. We'll talk a little bit more in your questions, I hope, about some practical strategies, but as kind of an overarching theme, I'm always going to put a plug in for strength training and movement. And luckily we have Chiara here who's going to go over that in detail. But truthfully, I always say if folks came in and they got a prescription for exercise, they probably wouldn't come back and see me, or not as quickly. So, even if it's walking, that's a great start. But truthfully, weightlifting, strength training will have so many benefits in your life. Better sleep habits. So that's really around sleep hygiene, creating a routine, sticking with it. Everybody on this call should leave here with a bedtime tonight. We are going to have a bedtime, and we're going to stick to it, and we're going to get up at the same time every day, and we're going to keep that circadian rhythm just flowing. So beautiful. Boundaries and reducing overload. So when I talk about boundaries, and I hope that there'll be questions about this, boundaries is not just saying no, but boundaries is really for yourself. It's not anybody else's job to respect your boundaries. It's your job to uphold them, right? And this is something that we could spend weeks and weeks talking about in sessions. So if this is something you feel you need to speak to, reach out after. Nervous system regulation. We're in a, kind of easily accessible society. Dings and pings and messages. And what happens is you allow your body to stay in kind of this fight or flight overload. So your nervous system doesn't know when it needs to stay on. Well, then you throw a little hormone imbalance, a little sleep disruption, and guess what? You're on all the time. And that is a autonomic nervous system dysregulation issue. And so there's a lot of breathing that can help that. Relaxation techniques, cognitive behavioral therapy. These are evidence-based methods that work. Nutrition and blood sugar support. Really, you need to eat every 3 to 4 hours. This isn't like high-tech science. You eat every 3 to 4 hours. Allow your insulin to spike and drop in a natural rhythm that is predictable for your body. And then in the middle, your metabolism floats along, right? In a perfect world. And then I think, to me, the most important thing is community and connecting. There's being able to have a place that you can go to, like a gym, maybe where you have the same people that you see all the time, or you play pickleball. I love my pickleball friends. I love my golf friends. Have a neighbor that you walk with, meet somebody for coffee, or you can even connect virtually. So text messaging and virtual messages are okay in a pinch, but humans don't actually connect like that neurologically. So it's good for now, but please move the conversation out of the group chat and into real life. And normal versus not normal. So these are some of the pieces where I said it's kind of that longer period of time without resolution. So normal is like occasional stress, had a busy day, like I'm tired, I'm going to make sure I get to bed on time. Temporary fatigue, wow, I've had a really hard time getting up this morning, or the last couple of days I've noticed I've been more tired. Emotional up and down, particularly with hormone dysregulation, and particularly early on in women's perimenopause or menopausal journey, you're going to notice that you have more symptoms that come up that are catching you as familiar, like when you were a young teenager, or they're catching you off guard completely. I'm feeling overly emotional, the rage, the menopausal rage is real. These are all normal, but still should be discussed with your clinician. Then there's the red flags, like actually waking up exhausted every single day, snoozing for hours. I'm being dramatic, but we never want to snooze. Constant irritability, so feeling like you're doing a lot of deep exhaling. Perhaps you're even getting some discussions at work. Perhaps you're feeling irritable around your partner, not wanting to be around people. Emotionally overwhelmed, when you feel like I just can't take anything else on, or you start to notice that you want to cancel plans. Those feelings of overwhelmed, when they start to last beyond a couple of days, a week, when we're talking like 2 weeks, 3 weeks, 4 months, or you notice that you have kind of a really low mood, that you're withdrawing from people, you're having an increase in anxiety, you're noticing that your heart races without cause. These are reasons, what we would say, these are red flags. So reach out for help if these are some of the things you're experiencing. And help can come from many different ways. So of course we're there. The auspice of our clinic is mental health is integrated in everything that we do. Even if you're seeing our nurse practitioner for hormone support, you're going to talk with a clinician, somebody who's either a social worker or a psychotherapist, who's going to support some other lifestyle habits. Your family physician is also a great way to start. You can call, we have lots of call lines in Ottawa. We have Distress Center. Those are free services. Our services are private healthcare, but covered by your benefits. We also do direct billing. And I always say this, mental health support can actually come from a variety of different ways. They don't always have to be a professional lens. So friends that are healthy and impactful in your life, your pet, right? Being able to maybe sit down and read. There are lots of different ways that we can get mental health support.
Thank you so much, Christine. Okay, so I'm gonna switch gears into sort of the active side of it. I think most people want to be healthy. Most people want to do the right things. And I think, there's been a cultural explosion of health and wellness in the past few years. But there's going to be inevitable obstacles to these things. And I see them every single day with my clients. So the top 4 that I usually see, and they all sort of overlap, are energy deficits and fatigue, poor sleep, being overfueled and undernourished, and injury or joint discomfort. So usually the energy deficits and fatigue are the first questions I'm going to be asking are, how is the state of your nervous system? Like, what are you, like, exactly like Christine said, are you completely overblown, like spread too thin? Or, screen, and then, rushing. And then you have no energy for the things that are important to you in your life. And then it feels like, okay, God, now I have to put working out on top of this. So I think number one, you got to ask, am I in a place that's regulated enough to start adding more to my system? If you're not fueling yourself, if you're not sleeping, if you're not paying attention to yourself, is adding another thing to that pot going to help you? So I think that's an essential question to ask for most people. But there is a saying I heard a little while ago that was amazing, and it's that strength training and weight training and exercise, it adds stress to your bucket. But what it also does is it pokes a hole in the bottom. So it's a drainage point for you as well. And I think healthy habits beget other healthy habits. So giving yourself a starting point, just getting your foot in the door can, lead to a cascade of a whole host of healthy habits. Next, I think you want to look at blood sugar regulation, nutrition timing, and looking at like your insulin levels. So many women, so many people in general are struggling with blood sugar dysregulation and insulin resistance. It is so extremely common, and especially common, as we mentioned a few times now, in later life. So are you experiencing like huge peaks in your energy from, maybe sugar highs, or a poorly timed carbohydrate intake, and then huge drops in your energy where it's like, I can't function without having a nap in the middle of the day? Or like Christine said, are you waking up at 3 a.m.? That's a huge sign that your liver has run out of glycogen to continue its detox. It's also a sign that your cortisol is peaking too early. And it can also be an indication of sleep disordered breathing. So that's what you're going to want to look at. You're going to want to look at poor sleep habits. Do you have good sleep hygiene? When you carry excess weight, one of the first places that gains visceral fat is the tongue, which is going to massively contribute to poor tongue posture, which is going to make it really easy for that tongue to slide back into the throat and contribute to snoring. So you're going to want to look at, am I snoring through the night? Am I sleeping through the night? How is my sleep quality? Am I waking up feeling exhausted? Because if you are strength training and weightlifting and you're not sleeping, that is a great recipe for burnout, and for not seeing any results. So, really living a healthy, active lifestyle is kind of a religion in a way. You got to be consistent. And I think this all ties back to the idea that, you need clarity. You need clarity. Like, you actually need to sit down with yourself and think, what is it that I actually want from myself? And what do I need to do to make that happen? Because, everyone's super busy these days. There's always something to fill your time, and, something's got to give. So you really got to figure out, like, what is it that I want from life? And what am I willing to do to accomplish that? So being extremely clear about your goals and what you're struggling with is a huge step, because then you can know where to go, who to go to, and where to start, and what the biggest priority is. And most of the time it's sleep. So yeah, you want to screen for sleep apnea and sleep disordered breathing. A lot of people overfueled, undernourished. So eating a ton of calories, but a lot of it is just really not supplying the micronutrients that you need to get through your day and feel energized. And then injury and joint discomfort. So are you moving enough? Are you working a desk job? Are you giving little movement snacks? Are you getting up during the day? Are you supporting your connective tissue? There is an epidemic of connective tissue disorders these days. I see it constantly. Next, so resistance training and aging. So number one, muscle helps regulate your blood sugar. It's like a sponge for sugar and glucose, and it'll pull excess sugar out of your bloodstream and into those muscles. Again, collagen production, bone cells, your bones and your connective tissue decline with aging, declines with hormone decreases. So that increases osteoporosis risk and issues like hypermobility disorders. And again, we haven't talked about this yet, actually. So pelvic floor health, in my opinion, should be trained proactively. Obviously, if you're having full-blown issues, you need to go see a pelvic floor PT. But This is a proactive women's health strategy. Incontinence is one of the main reasons why women enter hospice care or in long-term care homes. So there was a study that was done in 2016 where they found that a lunge, among other exercises like squats, activated the pelvic floor 42% greater than an isolated Kegel. So, weightlifting is also pelvic floor health. But again, go see a pelvic floor PT if you're having issues. Again, you need to train hard. And what you can do in the gym is extremely reliant upon what you can recover from. So can you sleep? Are you eating enough? Do you feel fulfilled in life? And do you believe in yourself? Do you truly believe that you can do the things that you are asking your body to do, that you want to do? And that's a huge component of it. I want to get a few myths out of the way. So a lot of people say like, oh, I don't want to get bulky from lifting weights. And to me, that's like saying like, you don't want to get your driver's license because you're afraid of becoming an F1 driver. Okay. Like people, like bodybuilders take steroids and train for years and train super hard to get bulky. And I want to highlight that bulkiness usually comes from excess fat or inflammation. So your dream body has way more muscle than you think it does. Cycle syncing, very popular thing on social media right now. Not necessary. You got to learn how to auto-regulate your training instead. You'd be surprised how often less is more. My favorite thing to say to clients is a lot is better than a lot, a little. So if you are able to set in, little bits of exercise throughout your week, that's going to be so much better than being like, oh, the only place I can fit it in is Monday at 3:00, and then you're only getting in 1 hour of exercise a week. Take little rations of it and see what you can do with a little at a time. Women should lift weights for higher reps or do activities like Pilates and yoga. So I think this is really linked to chasing the burn, exhaustion, productivity culture, Instagram culture, where people think, I just gotta feel exhausted. I gotta really sweat, and that's what an effective exercise is. No, you gotta lift heavy things, and you gotta do it consistently, day after day, week after week, month after month, year after year. A lot of this myth came from the fact that a lot of women have more fibers that are suited for endurance, muscle fibers that are suited for endurance. So this myth came, oh, no, women are better for doing high reps instead of lifting heavy weights because men have more muscle fibers that do that. But we have both types of muscle fibers, and you gotta train both of them. And then cardio is better for fat loss, and weightlifting increases cortisol. I hear this all the time. People are like, oh, I'm going to try to lose fat, so I'm going to just like stop going to the gym and just, run for a little bit instead. And I'm like, okay, well, have fun being skinny fat because you're going to lose all of your muscle. So, cardio is great for your heart, and it should be integrated in any program, but you gotta lift weights if you want to keep your muscles and your bones healthy. So importance of proper fueling to support all of these goals. Micros and minerals are the new macros. So that is what actually micronutrients and minerals and vitamins are what give your body the tools to be able to absorb the food that you're eating. I want to highlight B1. I want to highlight vitamin D3 and K2. And I want to highlight magnesium especially. I listed these guys at the bottom. The L-glutamine, I love to suggest that for any client that has any gut inflammation because it helps to modulate bad bacteria in the gut, and it helps to improve the gut lining. So if you're having a lot of bloating during meals, I really suggest trying that. Magnesium L-threonate. It's the only type of magnesium that can cross the blood-brain barrier, and I love giving that to clients or suggesting that to clients who have trouble winding down, have trouble relaxing. B1, that's going to be all the B vitamins are going to be really important for helping your body metabolize carbs and fats, but you really want to make sure you're getting all of that in. And then D3 and K2, great for bone health, Great for supporting your ability to for bone density, really. So yeah, blood sugar stability and microbiome have a huge role in stress. So if your blood sugar is going like this all day, and you are experiencing bloating, gut issues, that's going to cause a lot of disruption in your ability to manage your stress, which is all going to go back to the nervous system, which we will definitely chat a little bit more about. This is a little sample training week. I can send this to you guys if you have any interest in that, but it's sort of an idea of like, you know, you don't need to be in the gym every single day to see results. So as you see, I put a little day on Monday, plyometrics and full body hinge training. So that's gonna be like a deadlift day, for example. Wednesday, another mobility or squat day. And then Friday, another plyometrics and full body unilateral training. So what that really means is you're training your jumping, you're training your bigger lifts, like squats and deadlifts, heavy pressing, heavy pulling. You don't need to have, you know, dedicated arm day, dedicated upper body day, dedicated lower body day. You can spread it out and do full body every single day. But really, the most important thing is that you're being consistent in whatever you try to do. If you're going 1 week 3 times a week and then another week 1 time a week, maybe that's a time to, you know, sit down and think, okay, what can I actually do? What can I commit to? Because the best plan is the plan that you're going to follow. So yeah, I would love to talk about that more if anyone has any questions, and you guys can reach out to me, but I would love to get onto our roundtable chat. If you guys have any questions, reach out to me at, if you can get my email from this, we can see what we can send out to you guys, but I'm at Freeform Fitness in the Glebe, and yeah, we have some questions in the chat, so we'll get to that in a little bit. But I want to start it off by going to hormonal changes through different stages of life. And I'd love to hand this off to Dr. Ben first, just to sort of give us a little lay of the land for what we're going to go through, especially during menopause. It's a hot topic.
Thanks, Chiara. Yeah, I mean, there's so much to talk about here, as everybody can see. So I'll try and summarize it. So basically, as I kind of showed you before, there are essentially 4 stages in women's life that I kind of think about in the kind of a large cycle changes, and then there are kind of your monthly changes, and then there's kind of micro fluctuations between your monthly menstrual cycles. But kind of the big picture that I look at is kind of pre-puberty, then it's going to be your childbearing age, and then that is interrupted for some women, not for all, with pregnancy and postpartum, where you have kind of these cycle changes. And then ultimately you're going to have perimenopause, menopause, and postpartum. So those are kind of the 4 major kind of large cycle changes that you would see. Obviously, you have your menstrual cycle that everybody's familiar with, and yeah, hormonal changes that comes with that. So we probably don't have to go into as much details with that. And the main thing that we're going to talk about for the large cycles is going to be estrogen and progesterone, right? Like those are kind of the main 2 hormones for women that probably have the largest amount of impact on your cardiovascular health, your metabolic health, your mood changes, and your emotional health and memory, as well as your sleep. And the way kind of I think about that is essentially your estrogen and progesterone peaks during your reproductive age. There's massive changes in that during pregnancy, where generally speaking, a lot of the changes that we see during pregnancy are driven not so much necessarily by the fact that you have very high levels of estrogen and progesterone, but is driven by the fact that you have this extra person growing inside of you. So it's basically everything kind of goes up. So your stroke volume goes up, your heart rate goes up, your blood pressure usually actually softens down because of the estrogen effect during pregnancy. And then post-pregnancy, in postpartum, you almost have a withdrawal from a lot of those symptoms. When you're kind of like, the way I describe it to a lot of my patients, that you're kind of high on hormones during pregnancy, and then you have a crash after pregnancy. And that is in a very simplified way, the way to think about a lot of issues that happens postpartum. So postpartum depression and anxiety that Christine can kind of talk more about, but also a lot of cardiovascular changes that we deal with postpartum, particularly a life-threatening condition called postpartum cardiomyopathy that we sometimes see. And then perimenopause, menopause, and postmenopause are primarily driven by the fact that your estrogen progesterone levels start to drop again. And then ultimately, once you're fully postmenopause, you essentially have no estrogen. Your estrogen levels go to zero. So those are kind of in the big picture what you see, but then your small changes that happens not necessarily cyclically, that I think both Chiara and Christine talked about that are important. Probably one of the most important hormones would be cortisol, right? So your cortisol levels change. It's regulated primarily by your circadian rhythm. So you actually have fluctuation in your cortisol over 24 hours, whereas we talked about estrogen progesterone cycle usually be at least 1 month long. Your cortisol cycle is less than 24 hours. So within 24 hours, you go through one cycle. And the pattern of that cortisol fluctuation really affects everything from your mood, your memory, to how you sleep, to your metabolic health, to your blood pressure. So cortisol is a massive, massive hormone when we talk about a lot of these changes that we talk about, your physiology, your health, your longevity.
Yeah.
And the other last hormone that I would talk about for women specifically is thyroid specific. Now, there are many other factors that we can talk about, but these are the most prevalent ones that cause severe conditions that require pharmacological replacement of these hormones. I think these are going to be the big ones. Thyroid issues are much more likely to happen, much more prevalent in women compared to men, and is because thyroid very much interacts with a lot of with your estrogen progesterone. So we generally see thyroid dysregulation issues a lot more prevalent in women. So when I have women coming to me with variety of complaints like fatigue, lack of energy, sometimes sleep issues, body composition changes, as well as some of the cardiovascular things, we always check their thyroid because that could certainly be a contributing factor. So that's kind of the broad stroke, what I would kind of think about, kind of estrogen, progesterone, cortisol, and thyroid. They're probably the four main ones you need to think about as kind of the top priorities.
Mm-hmm. Ben, I'm curious, do you have any, as complicated as hormones are, do you have any, quick tips for people who might be looking for what kind of red flags would be raised if you're going to start seeing problems with estrogen, progesterone, cortisol, just the main ones?
Yeah, so I think it really depends on what stage of life you're in, right? So I think in women who are in reproductive age, generally speaking, estrogen, progesterone, it would be very, very similar to kind of perimenopause and menopause, right? So if you're young, I would say, you can have premature ovarian failure, for example, right? When women actually develop menopausal type symptoms way earlier. Typically speaking, we consider someone going into premature menopause if they're younger than the age of 40. It's a major risk factor for all sort of bad things happening in your body, right? And the alarming signs, the warning signs are very similar to when you think about a perimenopausal woman. So palpitation, body composition changes, so unexplained weight gain, unexplained fatigue, significant change in your blood pressure. Blood work obviously is very important at some point if you're developing these symptoms, because we can see a pattern on your blood work with regards to how your lipids are changing, are going to have a particular pattern. Your blood pressure starts to rise. So these are, generally speaking, the changes that happen in perimenopause in women who are before that age, so younger than the age of 40. If they're having something like premature ovarian failure, they're going to have those kind of perimenopausal symptoms. So that's kind of one of the ways we will know.
Yeah. Would something like PCOS, or it's recently been renamed PMOS, would that be sort of a premature risk factor for premature menopause?
Yeah, so PCOS very much kind of ties into this. So PCOS is for us a huge cardiovascular risk factors, right? Because as you probably know, it causes insulin resistance. So it kind of causes almost like a metabolic syndrome type disease. So blood pressure is really high, lipids get out of whack, blood glucose starts to go up, these women gain weight, weight gain. And then the other part of it is also they have this androgen effects, right? Because they actually have predominant testosterone effect. So they start having abnormal hair growth. So definitely if you have any of those symptoms, then I would kind of be thinking about more about PCOS and all the risks associated with that. And obviously that's a very important condition to diagnose and treat.
Yeah, I think like one of the things that I get from conversations like this is like the massive amount of overlap between all of these issues and how it really is, in my mind, one issue. And it's stress management, sleep management, blood sugar management are always the big three in my mind. It's like, you're not sleeping, your blood sugar is going to be crap. You're not sleeping and your blood sugar is crap. You're going to have terrible energy. You're not going to want to work out. You're not going to want to do anything. The snacks that you're going to be reaching for are going to be completely different. Like your energy first thing in the morning, like you're not going to be wanting to eat a protein, fiber, like micronutrient dense breakfast. You're going to be wanting to, get coffee and something sugary because your body is starving for energy and you're like, I need to just be able to function, especially in like such a high functioning society now where it's like we are asked to be on all the time. Our phones are ever present. Everyone's a workaholic. Everyone's got 3 side hustles. Like, and it just feels like it's all the same issue, which is stress, sleep, insulin resistance. In my mind, at least. I don't know if you guys agree, but
100%.
Yeah. Christine, are you muted?
I'm putting something in the chat for folks to see. They might find this interesting. I know we talk about stuff, but I'm going to tell you the actual pattern that happens when you're stressed, what happens, and why you crave the coffee. Listen, I'm not poo-pooing coffee. Like I wake up to drink coffee, but as we get older, sometimes that first cup of coffee actually does trigger a hot flash for me. And it sucks, right? So we start to have to adapt some of our behaviors that we did when we were younger, or, we were still with plentiful hormones. And then as things change, if you're not supplementing early enough or whatever the case, sometimes we need to make some lifestyle adjustments. I really like what you mentioned about the less is more. And I think that that's this culture we have to get out of our head. I'm not too sure of the age range that's here, but if you're kind of in my age range, we were really conditioned that cardio was everything. We learned like aerobics. I grew up in the era of aerobics. My mom was an aerobic instructor, and I started running long distances when I was really young, always thinking that it's cardio. That's how we stay healthy, right? You just keep your heart healthy. And I had to unlearn a lot of poor social pressures and misogynistic traits that were embedded in women's fitness in order to learn that, I actually need to stop cardio. I had to stop cardio for so many years just to lift weights and be able to make some changes in my body. I was able to put in walking back in my life, but for the most part, that's the only cardio that I do is walking outside.
Yeah.
For pleasure. Right, for my mental health, to spot and like listen to the birds. I like to smell the flowers right now. It's really lovely, but that's it, because nothing is getting my heart rate up more than the lifting that I'm doing at the gym. I promise you. And I track it. I'm a big fan of wearables. Tracking how high my heart rate ranges when I'm lifting weights that's what's really impressive for cardiovascular for me. So less is more sometimes.
No, it's interesting you say that. And like, I think there's such an epidemic of like, you got to do everything right now. Like everyone and their mom did a half marathon this weekend, and it's amazing. But it's, I think what you said about like women, especially feeling like such a big pressure. It's like there was a big cardio, moment where it's like you got to do HIIT, you got to do super intense. And I think if you're already dealing with so much nervous system dysregulation, your nervous system is on all the time, you really got to learn how to dial back and then build from there. Because I think, load management and recovery management and what you're doing throughout your week is going to be the number one thing to pay attention to. You cannot adapt to what you can't recover from. And sometimes the only thing that you can really handle is maybe a brisk walk, and that's fine, because for a lot of people, you don't even realize that your, zone 2 or zone 3 is actually just a walk, which speaks to a general lack of fitness in.
Right. And a walk without your dog, because it interrupt us. And when you say brisk, the intent is just consistent without stopping.
Yeah, exactly.
That's why we say, like, don't walk with your dog if you're going for exercise. And to be honest, my dog just annoys me with how much time she stops.
Yeah.
So I think that that's really wise. I wonder if you see in the gym people who are training, but they have their phone and they're like in between trying to send a work email. And so that when you talk about like dysregulation and stress or fight or flight, right, it tells our body there's a danger and we have to respond right away. That is robbing you of your peace, of good mental health, of good coping strategies.
Yeah.
It's training you to look for immediate gratification and dopamine.
Yeah.
We can only get from outside world. We can't make it. So this is why phones and being on all the time are actually really detrimental for your health, particularly over time. It's like the sneakiest of sneaks. It starts little and you're like, I can do this. I can manage a household. I can work this job. I'm professional. And then all of a sudden we start to see when hormone shifts happen, hey, I'm not doing as well. I'm really forgetful. I'm stressed out. I'm gaining a lot of weight in the middle.
Yeah.
And this happens because your body is constantly on. And so I really like to be able to teach women how to regulate their nervous system through healthy habits, through techniques, brain altering techniques like psychotherapy, right? To give them the good coping skills. Sometimes we bring in the big ammunition, like we have alternative like ketamine or things like that. That might be a little bit more helpful for people. But truly having a regular routine, consistency with your sleep, like Ben talked about, circadian rhythm is everything.
Yeah.
You take anything away from this, like, to me, this is it, because sleep is everything. Without sleep, you're just going to be dead. Okay. Just going to get the dead. So if you view the sunlight in the morning, it cues your brain to wake up. Your brain's like, okay, this is what we do. We release all the wake up hormones. We get going for the day, ready to act. If you view the sun setting, it has the same effect, but in reverse. Oh, it's time to get ready for bed.
Yeah.
And then eventually you follow this beautiful pattern of kind of like humans were made. We're meant to be up during the day, gathering food, running for after tigers, whatever we did. And then at night we were supposed to be sleeping or dead. Like we had a couple of switches. That's why we have the off and on. And when I say you're always on, that's the running from tiger switch. So let's teach people to put a dimmer and let's learn how to regulate.
Yeah. The phone thing is so interesting too that you brought. I wanted to say, I read a study recently that was talking about checking your phone in between sets actually reduces motor unit recruitment in your muscles. So what that basically means is the amount of muscle fibers that are being recruited to complete the task that is lifting the weight is reduced when you've been looking at your phone. So that means, less energy, less motivation to complete a set. You can't push as hard, and your brain, your muscles and your brain aren't getting the highest stimulus that you could get if you were lifting heavy. But it's so true, like on all the time. And it's not just like, the addiction and the dopamine stuff. It actually causes macular degeneration. Your the tension that it causes in your body. I see it all the time. You're, having your eyes fixed on a screen this close is indicated and correlated with myopia and eye issues. You're also teaching your eyes to be focusing on this tiny little thing, which increases facial tension, neck tension, shoulder tension, whole body tension. It changes your breathing strategies. It changes your breathing habits. It is so important to take breaks, to move away, and to remember, like, you're a human, you're not a drone. And
now we're all gonna walk away and like throw our phones out.
No, actually, like I've been thinking about getting a flip phone for so long, and I'm not even joking. I'm gonna do it, but it's like
that's so
interesting.
I have a hormone question for Ben about, just because we're talking about weight training and the importance of resistance training for women. And so Ben, one of the things, like, tell me one of the hormones or what the implications of not having maybe HRT on board as women are losing their hormones, right? Because we're losing hormones because we're supposed to be dead, but we live longer than 50 now. How could that benefit women when they're trying to create a healthy habit of like lifestyle change with weight training and, you know, overall health improvement?
I mean, it's huge. I mean, as you probably know, Christine, and everybody has kind of heard of this women's health initiative that came out in early 2000s, right? And really changed the attitude of healthcare system and the doctors about hormone replacement therapy. And the reason was because before 2000s, and some of the audience might remember, a lot of people might not have been at the age where they were exposed to it, but essentially hormones were like, everybody was getting it. So as soon as you were kind of hitting 50 and 55, all women were getting hormones. And it was considered basically a cure to all issues for women past the age of 50. So it got to a point that by early 2000s where, you know, like a large proportion of women over the age of 50 were on hormones. And basically doctors were giving it for a variety of ailments. So the whole idea of Women's Health Initiative was to, and then basically there were signals, right? Because women were getting it at a much later stage in their life. Like women in their 70s and 80s were getting hormones back in the 80s and 90s, because we didn't think there was anything wrong with giving women hormones, because essentially the hypothesis was this is a woman's hormone. This is what makes them women, which is really true to a lot of to a huge extent. So replacing a hormone that is natural to your body should not have any issues. And that was kind of the mentality over the 70s and 80s and 90s. What the Women's Health Initiative unfortunately did was that it recruited the wrong group of patients. So there was a huge group of people in Women's Health Initiative that were much older. So there were women way older than 60. There were women in their 70s. There were even women in their kind of early 80s in Women's Health Initiative. So the challenge became, as you know, there was a signal for increased cardiovascular disease, cardiovascular events when you got estrogen in older women. And the other issue was the type of estrogen and progesterone that was being used. So then all of a sudden we said, after Women's Health Initiative came out, that nobody should be getting estrogen and progesterone because it has no benefits. Now, over the last 20 years, since Women's Health Initiatives, now we have all this data that suggests that probably a happy medium is a perfect place to be. So now where the state of the scientific evidence is that, and this is essentially what we practice at our clinic, is that, you know, if you are between the age of 40 and 60, and you have sufficient evidence, clinical evidence, it doesn't need to be supported by any sort of blood work. But if you have clinical evidence that is strongly suggests that you suffer from estrogen, primarily estrogen deficiency symptoms, and we can kind of go through what those could be, then most likely going on hormone replacement therapy, which for most women with uterus would be a combination of estrogen and progesterone, that would dramatically have a lot of health benefits. And we talked about a lot of these health benefits, and you talked about it. So health benefits, cardiovascular, right? Brain. So brain fog, emotional stability, memory, sleep. Then you have musculoskeletal, right? So muscle, skin, joints, and then you have bone, right? So which is huge, right? Like bone health is massive, right? So how fast you lose your bone mass as you get older. Huge risk for women as they get older. They develop, you know, bone fractures, falls, hip fractures. So all of those are essentially going to be beneficial. And then a big one is essentially your metabolic health, right? So weight gain and body composition changes that happen through perimenopause, a lot of that could be in combination with a good lifestyle strategy can be reversed by being on estrogen. So really affecting a variety of organs, as long as it's given to women over 40 to 60. I would say if you're more than 10 years past menopause or over the age of 60, most practitioners would agree that it's probably not appropriate to start hormone replacement therapy at that age. But when you're in that window of 40, 60, that is kind of the perfect window to kind of benefit from a lot of these benefits in multiple different systems that I talked about. I don't know if that answers your question, but it
did, and it kind of sparked this thought that sleep really ties into that nicely, because this is the kicker. the most important sleep that you have in your later years to prevent dementia is actually 45 to 55, which is when our sleep is the most disrupted because of hormone changes. So I'll just drop that right there for everybody here, and they can make the best decision for them. But we talk about brain, we talk about muscle, we talk about being able to capitalize on these years. Just consider your overall health in that conversation that you have with your primary care physician, with Dr. Ben, with our clinic, with whatever clinics you look for. But think about that.
Yeah. Yeah. So we're at 8:05 now. We did touch most of the topics we were hoping to. I'm wondering if anyone still in attendance has any questions that are specific for us that we would love to answer. Otherwise, what other thoughts do you feel like you didn't fully get out? I feel like, oh my God, it's just been so packed. There's so much to talk about, and I could spend another 2 hours doing this. But Christine, Ben, what are you thinking?
I think we're good. I think
We covered everything.
Yeah, I think we covered a lot of stuff.
It was. So I wanted to say, guys, I've got a bunch of things to bump through. Thank you so much for coming. I'm sure we're going to send off some things after this about how to get in contact with any of us if you guys are looking. Me and Victoria did also want to offer, we do have a Women's Health Month offer at Freeform Fitness, where it's 8 sessions. Or no, it's a free session, I believe. Yeah, so if you guys want to reach out to us, we'd love to connect with you. And yeah, please do not hesitate to reach out if you guys have questions. And Christine, any closing remarks?
Well, that was great. Thanks for having us. It was fantastic.
Yeah. I always say this is our social media plug is follow us on social media. It's Focus Forward Health Group on Instagram. We have a Facebook page. It's brand new, so it's not very good. But therapy is not found on Instagram. It's meant to just be for fun. And real therapy, real health happens in a regulated clinician's office. So not on the internet. Find the qualified practitioners to help you with your health.
Yeah, 100%. And you can kind of find us Cardiac Longevity Clinic. So our website is cardiaclongevityclinic.com, and then social media is at Cardiac Longevity.
Thank you so much, guys.